I'm going to demonstrate two seated C0-C1 adjustments, upper cervical. These are both variations of lifts, and the preload for this is going to be lateral flexion and rotation away. So ipsilateral, lateral flexion, contralateral rotation. When the rotation is applied, it's only to bring that nose back to the midline. Right? So we'll retract a little bit. Our contact's going to be the middle finger right along the occiput. So let's get that in place. Drop the head to the left a little bit. The auxiliary hand contact's going to cover the ear with the thumb behind the occiput and the fingers spread out. The doctor is in close. There's a little bit of a lift applied with both hands. If you look at the forearms, you'll see them almost parallel to one another. And hold your head there for me for a moment as I release. And you can see that there's relaxation. The doctor is going to get very relaxed before delivering this. The thrust is towards the doctor, not in a rotary manner, but towards the doctor. All right. The other variation of this is it's the same adjustment really, but instead of using the auxiliary hand to lift and thrust, we're going to use the doctor's upper chest to do that. So the setup looks exactly the same, so you'll see the setup from the other side now. Here's the contact. The ear goes in the web for the upper cervical area. If we were doing this lower cervical, we can move the hand down a little bit if it was for mid or lower cervical. But we're on the occiput, and the thenar is resting on the mandible. Common student doctor mistake here is to apply pressure to the mandible, kind of like that. And you want to spread the force out between the contact on the occiput and the contact on the mandible, because they're connected, and that way there's no excessive force on the mandible. So what we're going to do here is just lean forward a little bit, and I reinforce the hand, and it's a little bit of a thrust in and a lift up. But again, doctors relax prior to the delivery and just lifts up. All right? Thank you very much.